Welcome to today's webinar. My name is Emily Jacobs. I am an instructional designer here at MedU. Assisting me today will be Maria Minicchiello, who is also an instructional designer. And Maria will be monitoring the chat room. So as I'm going through the presentation and you have questions, feel free to use the chat function. You are all muted right now, so we wouldn't be able to hear you if you were to speak or ask a question, but we do encourage you to use chat. We'll also allow some time at the end of the session in case you have any remaining questions. Today's webinar is about getting started with our new learning management system. And this webinar is specifically focused for WebGEMS users. However, I will be covering all of the basics that you need regardless of whether or not you use WebGEMS. And so feel free to stay online if you're just a program looking to get set up in the new LMS. For those of you who aren't familiar with WebGEMS, WebGEMS is a collection of geriatrics-focused virtual patient cases that MedU has brought on board this year. So in today's agenda, I'm going to cover a little bit of background on why WebGEMS is moving from the POGO-E site over to MedU. We're going to talk about how to transition your program into using the MedU's new learning management system. I will do a review of the various roles and permissions that are available in the system, and then show you how to add users and how to assign permissions within the system. I will also demonstrate how to set up custom courses or blocks, talk a little bit about communication and how to let your users know about the new system and how to access it. And I'll also do a brief demonstration of the student experience and show you what a case looks like from a student view and highlight some of the new features that we have available. And then we'll leave some time for additional questions and conclusions at the end. For those of you who are new WebGEMS users and you haven't used a MedU course before, we wanted to provide a brief background on who MedU is. MedU is a nonprofit organization that delivers healthcare education by virtual patient cases. And these cases are brought together to comprise courses. All of the cases are very high quality. They are regularly reviewed by a consortium of physicians, and they're peer reviewed and updated on a regular basis. Each year we have over 40,000 students using MedU courses at over 200 institutions across the world. We offer courses in a number of disciplines, including surgery, pediatrics, diagnostic excellence, internal medicine, family medicine, radiology, and others. And so WebGEMS will be our first geriatrics course. WebGEMS, when it was originally developed using grant funding, was developed using MedU courses as a model. So WebGEMS is a very natural fit to come on board with MedU. And WebGEMS will be the first geriatrics course available in the MedU portfolio. Until now, for those of you who are WebGEMS users, know WebGEMS has been available for free on the POGO-E website, and this was supported by the AGS and various forms of grant funding. However, some of the grant funding is coming to an end this fall, and because of this, a new partner was needed in order to offer these courses and make them available. MedU was chosen as that partner so that we can continue to offer WebGEMS online and keep it maintained and keep it at the level of quality that everybody has come to expect. If you are a user who created an assignment on POGO-E prior to September 2016, that means that you have free access to WebGEMS through MedU for this academic year. Beyond that, it will be available by subscription. If you are on this webinar as a current non-WebGEMS user and you're interested, it is available by subscription currently. So we'll have subscriptions available for the 2018 to 2019 academic year for those of you who are coming in from POGO-E and you're interested in continuing on with access to that course. And MedU will continue to work in concert with AGS, providing proceeds from the subscriptions back to AGS in order to continue to support their work and maintain that partnership. Whether or not you are a new WebGems user, getting your program up and running in the new system is relatively simple. We recommend a pathway that's diagrammed here on the screen. First, you need to add users into the system and assign them into the correct roles. Then you need to add your students to the system by uploading your program student roster. Next, you set up customized courses if that's something that you're choosing to do. Then you invite students or communicate out to students to let them know that the system is available and ready to access. And then finally, as they get in and start using cases, you will be able to track and report their progress as they move through the course. Throughout this webinar, I'm going to be doing demonstrations of those steps, so you can follow along with me on my screen. I'll be actually logging into the system and showing you how to add users, assign roles, create a custom course, in addition to the demonstration I'll do. Before you get your program set up, there are a few key pieces of information that you'll want to have handy. The first is the start date of your next rotation or block. So you want to make sure that you're getting your program set up ahead of time, ahead of that date in the new LMS. You yourself should be registered in the new LMS with your profile created. Your student roster needs to be prepared, and to add students or any other user into the new LMS, all you need is their email address. And we do recommend that you use their institutional email address. That needs to be ready for a group in an Excel spreadsheet, just in one column as a column of email addresses only. Also, you should have at that point reviewed the roles and permissions thoroughly and have the emails of individuals within your program that you need to add in, and have an idea of what role you would like to put them in. In terms of when to transition to the new LMS, deciding on the time is important, is probably the most significant decision you're going to make so that you can get things ready and started and set up for your students. If you are, if your institution has historically subscribed to courses in addition to WebGems, then you may have students that are still working in the legacy LMS, and I'll address this in a moment. If you are a program that's new to MedU and you're only using WebGems, you will be starting all of your students automatically in the new LMS. The WebGems cases will be available on the POCOE site until October 31st if you need that access, but we do recommend that you go ahead and get your program up and running because they won't be available after that date. If you have been using other MedU courses, it is recommended that any of your rotations or courses that started before June 1st, you allow those students to complete their work within the legacy LMS, which is where they started their work. The work that is done in the legacy LMS does not carry over into the new LMS. So in terms of any type of reporting or student progress in those cases, it would not move over seamlessly. This is also true for POCOE. So the work that students may do on POCOE would not transfer to the new LMS. So it is important that if you started, if you have students that have been in the system since before June 1st, you keep them there to complete their work. And any new rotations or courses that start after June 1st or any brand new WebGems users, go ahead and start your students off in the new system. The legacy LMS, if that applies to you, will be available to students until October 1st, with reporting available to administrators until November 1st. Within the new LMS, there are 8 different roles, and each of those roles comes with a different set of permissions. It's not required that you have somebody in all of these roles, and for some of the WebGems users, I know your programs are very small, and you may just need a program services administrator, and that's fine. Every program is going to be a little bit different. But you do need to know what the options are for roles and who the individuals are at your institution who might be put into various roles. You must have a program services administrator, and this is our main point of contact at MedU. For many of the WebGems only users, you may be the program services administrator if you're on this call. However, for institutions where other courses are also being used, if you are a WebGems user, you should reach out to the person who is the PSA at your institution, and you were provided that name in an email. But if you've lost that information, feel free to reach out to us and ask them to make you a course administrator. And that will give you the permissions you need to administer the WebGems course. In addition to a program services administrator, that's an individual who can add users and assign roles and permissions, we have other roles available. The IT administrator would be an individual who is able to whitelist the MedU domain to ensure that any emails that are sent directly from the system get to people and don't end up in junk or spam folders. The student roster manager would be somebody whose only role would be to add and manage the student roster over the course of a year. A curriculum administrator would be someone such as a curriculum dean who's in a role of oversight over all of the courses. This person can view reports, and they can also assign course administrators. Course administrators would typically be individuals such as a clerkship director or course director. These individuals can also view reporting, they can create custom courses, and they can assign course managers. A course manager would be someone such as a site director. Their main permission is that they can view reporting on courses. And then we have teachers and students. Teachers would be preceptors or instructors, and these individuals can see the cases in a fully open state, meaning that they don't need to click through the gated navigation in the way that a student does. So they can see all of the material at a glance and understand what their students are working through. And then students will obviously be viewing things from a student perspective, and they will have access to all of the cases and all of the courses that your institution subscribes to. So we have a lot more detailed information about these roles on our online LMS guide, and I will point you there to do some more reading. And then what you'll need to do is consider with your colleagues within your own program which roles make sense for which individuals. I'm now going to demonstrate logging into the new LMS and give you an overview of some of the features. I'm going to log in as a program service administrator so that you can see that role. And so depending on your role in the system, you'll have access to different features once you log in. The PSA is the person with the most access to the most features. When I log in as a PSA, I can see 5 areas in the toolbar: courses, users, help, feedback, and my profile. The courses feature shows me all of the courses that my institution subscribes to. So I can see, scroll down and see a long list. Whenever this more button is blue, that means that there's more content to see, and you need to click on it until it's gray to be sure that you're seeing everything. So I can see in this sample program that we subscribe to a lot of courses. I do want to point out that for all users, including WebGems only users at this point in time, you have some free material available to you in addition to your subscription. So we have culture and health, medical home, a high value care course, a diagnostic excellence course, and an oral presentation skills course. And those are all comprised of cases or modules that focus on different areas that you may be interested in using. So we do encourage you to take a look at those and review them and see if there's any content that might be useful within your program. The users area takes you to where you'll manage your users, and I'll get into a little more detail on that momentarily. The help button is going to take you directly to our online guide, and this is what I was alluding to earlier when I said that you can come here to get more information on roles and permissions, for example. So before you make any decisions, you'll want to read through those and have a full understanding of what each role can do within the system. The feedback button pops open a form that you can fill out in order to submit a help ticket. And My Profile is where you would go to make any edits, changes, or adjustments to your profile. So I'm going to first demonstrate how to add users within the new learning management system. The program service administrator is the individual who can add users and assign roles. So once that's been determined for your institution, how you want to manage that, that person will be doing the input of the email addresses and assigning the correct roles. Within the new LMS, you can either add users 1 or 2 or 3 at a time or in a larger group. User email addresses are required, and again, we do recommend that you use institutional email addresses. You don't need to enter first and last names or any other data at the time that you're uploading people into the system. Please note that students and administrators cannot access anything in the new LMS until they've been added into the system. So that initial step of adding users is critical to getting people access. When administrators are added, they will receive an automatic email from the system. So anybody in a role other than student will receive an automated email as long as our domain is whitelisted. When students are added, there is no email generated, and this is by design so that you can control the messaging within your own program to let people know when the system is available. And we'll cover some strategies for managing that shortly. So first I'm going to demonstrate how to add an administrative user. So I'm still logged in as the Program Services Administrator. And because I have access to the user area. When you get into the user page, you can see down the left-hand side all of the roles that are available. So all 8 roles are listed here. There's a column labeled invited and a column labeled active. The invited column reflects the number of people that have been added into the system. So their emails have been added, but they haven't yet logged in or set anything up. An active individual is somebody who's received their email and they've logged in and they've gotten themselves registered and set up in the system. The total column will be the total of invited plus active users that are in that role. And the maximum column shows you the maximum number of individuals that you can have in the various roles that comes along with your subscription. And in some cases, we can make adjustments to that. So if you find your needs are different, you just need to reach out to somebody at MedU for assistance. To add a user, you simply click on the Add Users button, and I am going to add a course administrator. So I enter in the email that I want to use, and then when I click on this Group Role button, I can see all of the roles that are available within the system. I'll choose Course Administrator, and then I will click Add Users. You can now see that next to the Course Administrator title, there is one individual that's been invited, so that reflects that I just added that person. This blue bar shows that you've added successfully that email. If there had been an issue with the email address, or if I had accidentally duplicated somebody in the system, I would receive a red bar with a message to that effect. If you scroll down, you can see a list of your users as well. So you can see that I'm the PSA tester who's logged in right now. I'm active in the system. This person who I just invited is just showing up as invited, and you can see that the name says unknown, unknown. And that's because this individual has not logged in and registered yet. When you go in to register, you're prompted to enter your first and last name, and then that becomes reflected in this list as well. If you were to add somebody as a particular role, and then you were to say, oh, I added the wrong, we want to change that person's role in the system, you would just click on the Edit Role button, and then you would choose the correct role that you wanted to assign to that person and click the Update button. And then their permissions will get adjusted in the system. This is an example of an email that somebody would receive after they've been added into a role. And again, this is for any role other than student. They receive an automatic email from the system. It tells them what their role is. It provides a link to go to get registered, and it also provides a link to our online help guide. You can also add users as a group. So I'm going to demonstrate how to add a group of students. So you just click the Add Users button again, and then you open up your spreadsheet, which should have all of the emails that you need to add in one column, and you simply copy that data. Then you come back into this field and you paste. And you can scroll back up and you can see that there's been a list added. You give them the correct role. In this case, I'm adding them as students. And then you click Add Users. The blue bar again indicates that everybody was successfully added to the system. And I can see here that there are now 19 people invited as students, which is what I expected to see. So it's a good way to confirm that you didn't miss anybody. And then you can scroll down and see all of these individuals now are in this list, and they're all showing up as unknown because they haven't set up their accounts yet. And you can see the email address, and you can see that they're invited in their subscription status. So they've all been added. Again, you're scrolling down and you're clicking the blue More button until it turns gray. And now I know that I'm seeing everybody. If you needed to remove a user, you would just click in the box next to the name and click Remove Selected Members, and they will be taken out of the system. You can also search by email address or by name once they've entered their name. So that's adding a group. Generally, the larger groups will be your students, but you may have a group of teachers or something on record. You can also add them the same way. You just want to make sure that you're always choosing the correct role from this drop-down menu before you add anybody. Once you've added users to the system, all of the users are going to have access to all of the content that your program subscribes to. So for WebGems only users, this would be all of the WebGems cases in addition to the free courses that are now available through MedU. So in some cases, you may want to use the custom course function. And this is similar to creating assignments in PogoE. And so I'm going to talk about that briefly. If your institution subscribes to other courses and you also use the MedU exams, such as CLIP, which is pediatrics, FM cases, which is family medicine, simple internal medicine, or core, which is our radiology course. If your institution uses any of those exams, you must create custom courses in order to roster the students for those exams, and that won't be optional. Regardless, we do recommend that you use the custom course function. It's a great way to keep your blocks and rotations organized. And you can do it by date or you can do it by rotation. It depends on the needs of your program. When the reporting dashboard is available, you'll be able to generate reports that are specific for that custom course, which can make it easier to sift through the data. It allows you to track a group of students over time. And also, when students are added to a custom course, they do receive an automatic email from the system, so it assists with messaging. So if you've created assignments before in PogoE, this is a similar concept. And I'm going to demonstrate now how to create a custom course. So I'm logged in again as the PSA, but there are others who have the permissions to do this, such as the curriculum administrator and the course administrator. When you come into the courses area, you'll see this blue Create Course button. You just click on the Create Course. And then you would name the course whatever you'd like to name it based on the needs of your program. We do recommend that you use dates and other information that's specific to that rotation in order to keep these straightened, because when you go into your courses page, you'll see all of the custom courses for your program in the list. Students will only see the courses that they've been invited to, but any administrative users will see all of the custom courses. So it's important that they're differentiated from one another. You can enter in a description such as, the teacher name maybe that they're working with, or other resources that they're using, or other details that you want them to be aware of. And then you want to make sure that this access is set to invite access, and that is going to guarantee that only individuals that are invited to this course will be able to join it. And it will also generate an automatic email to anyone you add to the course within the system. Then you just click the Create Course button. So this is like creating a course shell, and once it's created, you need to then add your users and you need to add your cases. To add users, you come to Course Users, and you can add in one of two ways. You can either add by email, which is very similar to the way that we just added users to the system, or you can add by list. When you add by list, you're going to see a list of everybody who has been rostered, and you can select those that you want to be in this particular custom course. So you might just want to have 4 people in there, and that's fine. You click their names, and then you select Add Members. At this point in time, you also want to add any teachers or administrators that you want associated with this course. It is imperative that individuals who are invited to custom courses have been added into the system with that initial rostering process. That any permissions that they're given at that level are going to carry over into the custom courses. So if you add someone in as a course administrator, you don't need to verify that they're a course administrator at this point. Those permissions are established with their initial upload. So now we have some users. I'm going to go back out to the shell, and now we need to add cases. So if this were a group that we're going to use WebGems cases, I could do a search by WebGems. And again, you're scrolling down and clicking the More button until it turns gray. And now I know that all of the cases are showing. I could do Select All Shown and add those to the custom course if I wanted my students to do them all. Or I could just select several. You just choose the ones that you want, that you plan to assign to them, and you click Add. So now you have a course that only certain students have access to, that's named the way you want it to be named, and that only has particular cases in it. This is also an opportunity for you to explore some of the free content that comes with your subscription, such as the High Value Care course. And if you've gone through that and you've determined that in addition to the WebGems cases that you're choosing, you also want these students to see some additional cases from the High Value Care course, you can pick those and click Add. So you're now able to add cases or to choose cases a la carte from across all of our courses that your institution subscribes to in order to create your own custom bundle of cases. Another button I want to show you, and you can access this from within any course, is the More Actions button. So if you had a student working in WebGems cases and you needed to reset some cases, you would press More Actions, and then you would choose, I'm going to go back to my custom course, sorry. I would choose the person who needed their case reset, and I would choose the case that they need reset, and I would click Reset Cases. Also, if you're an exam user, the More Actions button is where you come to generate the exam roster that you'll need. And we have a lot more information on that, as well as a video on our online help guide. So we encourage you to look at that if that's a function that you need. This is an example of an email that a student would receive when you've added them to a custom course. So it will tell them the name of the course and give them a link to follow in order to get there and get themselves set up within that course. And just bear in mind that that does go out as soon as you add them into the course. So in terms of strategies for communicating with your users, again, anybody except a student will receive an automated email from the system as soon as they are added. However, for students, they do not receive that automated email. And this is by design because we want you to have control over the messaging to your students and to be able to do it in a way that makes the most sense for your own programs. So you can send your students an email that tells them to go to meduapp.com and goes through the steps of how to log in, and we can provide you with a template for that. You can also just put that information into orientation materials, or you can create custom courses and use that as a tool for messaging your students as they will receive those individual emails. We do have a student login area in our help guide that has screenshots and walks them through how to get set up. And everybody else will receive the email with the link. Our full reporting dashboard will be available later this month. The reporting will include how much time students spend on cases, how many sessions they've engaged in, and where they're at with completion of their cases. There will be a red, yellow, green color-coded system that will be a proxy for student engagement that indicates if they have completed the case, which will appear as green as the screenshot shows on the slide, yellow if they're in progress along with the percentage complete that they're at, and then red if they haven't started the case at all. You'll be able to view reports from the course level or the case level or the student level, or to use custom courses from the cohort level. So you'll have a number of options as soon as that dashboard is available. For courses that utilize the summary statement feature, you will now be able to view as well what your students entered into that summary statement field so that you can get a sense of their thought process as they go through their virtual patient case. The new LMS features mobile first design, so it is optimized for a mobile experience. It's a much more streamlined user interface. It's intuitive and easy to navigate. It offers anytime, anywhere access, meaning that the students can download their work ahead of time if they're about to get on an airplane or go into a hospital where they're not certain about the Wi-Fi. And they can do their work offline, and then as soon as they get back online, everything will be synced up and the reporting will be updated. And that means that they're not tied to having a stable internet connection. The ability to create custom courses is also a new feature that we're very excited about to help you manage your rotations and your students. And the dashboard that will be available later this month is very intuitive and will provide a robust amount of data. Now I'd like to show you a couple of things from the student perspective. So I'm going to log in as one of our test students. And I'm going to demonstrate a WebGEMS case. So the content of the cases has not changed, but the structure has a bit because of the new platform. And you'll also notice some slight changes in the titles. They've been renumbered, but the patient name has remained the same, and the description of the patient issue that they're coming in for that's being addressed in the case has also remained very close to what it was on the POGO site. Our cases feature gated navigation, meaning that the student can only see what comes next in the case after they've completed working through the current page that they're on. So for instance, in this case, I'm scrolling through and I'm reading this information and I'm taking it in as a student, and then I need to click the continue button when I'm ready to move forward. There are both multiple choice questions as well as free response questions. As a student enters their answers, they're getting automatic feedback on their answers. References are available as well, and then they click the continue button, and so on. So they go through the course. When they get to the very end of the case, there will be a blue button that says, get back to this continue button. Rather than a blue continue button, there will be a button that says finish case. When the student clicks on that, it's going to make a case summary available. In the case of all of our other courses, the case summary will be a compilation of the learning objectives and the key teaching points that were presented throughout the case. For the WebGEMS cases, this will be the exact same content that was in the case takeaways that were available on the POGOE site. So this will generate a PDF document of that information, and the student will be able to then either download it or print it if they would like to use it for further studying. We also have the clinical reasoning toolbar available. And within this area, the student can type in any thoughts they have on diagnoses, any key clinical findings. Notes is just an area where they can take their own notes. And then we also have a bookmarks function. So if a student comes across content in the case that they would like to bookmark or save, they can hover on the right-hand side of the screen next to the content that they would like to save. They may say, oh, I want to remember this for tomorrow when I'm in clinic. And all of that information will be saved here in this bookmarks area. Any work that the student does in the clinical reasoning toolbar will stay associated with them in their account as long as they have their subscription, unless the case is reset, in which case that's all lost. So those are some of the case features. And I'm going to show you a sample of what the case takeaway will look like. So this is a screenshot of the PDF that's generated. So you can see that there is a name and a time and a date stamp as well. And then these takeaways, the case takeaways, are the same as you became accustomed to in POGOE. So they include highlights from the case, key pieces of knowledge, as well as the learning objectives. If your institution is not only using WebGEMS and you do use other courses, and if you use WiseMD, we do have a special consideration for those users. WiseMD is actually a product out of NYU, and it's currently provided in a different platform. It's not within our new learning management system. In order to ensure secure and direct access to those WiseMD cases, and these are surgical cases, the students at this point in time were needing to add them into our legacy LMS to make sure that that access is seamless. In order to get that information, we need any institution who uses WiseMD to do the following. For your next rotation only, for your next surgery rotation, we need you to send an email to support@medu.org, and that email should include the date of the start date of the next surgery rotation for students that will be using WiseMD. And you should attach an Excel file that contains first name, last name, and email address of those students in 3 separate columns. That way we can get people manually uploaded into the system so that when that surgery rotation starts, they have access to the WiseMD cases. We will have single sign-on available shortly. This is just an interim solution while we get that set up. We do have a number of avenues for you to get additional support from, including our online guide, which contains a lot of information, as well as some really helpful videos that you can view on some of the common tasks that we've reviewed today. We do have a helpline, a phone line available with live assistance from 8 a.m. to 5 p.m. Eastern Time, Monday through Friday. If it's outside of those hours, we would encourage you to use the feedback button in the toolbar in the new LMS that will allow you to submit a support ticket. You can email the person who was assigned to your account with any specific questions you have. And also, we are running daily webinars, so we encourage you to have your colleagues and other coworkers at your institution attend these webinars as well, so that they can also get a sense of the new LMS and what the requirements are and just how it functions. We really appreciate your participation today. You will get a follow-up email after this webinar that has some additional links and resources in it, as well as a short survey, just 3 questions to find out, to get some feedback on the webinar and what we could do to make it more effective or what improvements we could make. So at this point in time, I'm going to ask Maria if there have been questions or if there are any outstanding questions that need to be addressed. Maria?
There are no questions right now, but this
Okay.
would be a perfect time for people to jump in and ask any. I think we're all set.
Are we all set? Okay.
Yeah.
Please don't hesitate to reach out to us if you find as you get into it that you do have additional questions. We're happy to help. And have a great day. Thank you.